I will jump straight on to Dr. Javanbakht to talk more about the study that he did on mental health and wellness. Thank you for joining us.
Thank you, Madiha. It's great to meet you all. I am Arash Javanbakht. I'm a psychiatrist at Department of Psychiatry, School of Medicine, and founder and director of the STARC. I was trained as a trauma psychiatrist and researcher, ranging work from neurobiology to treatment. We can go to the next slide. So my work has been focused on in a clinical realm. So I'm a clinician and a researcher. In the clinical work with mostly people who have sustained trauma, as well as people with anxiety disorders, specifically refugees, survivors of torture, human trafficking, and first responders, all 5 disciplines. We have actually worked with different federal offices in different aspects of this work. But when it comes to work relevant to this conference and research, I will not get to the details of what we are doing because this 7 minutes will not allow me to do so. Actually, I'm going to set up my timer to make sure I'm not going to pass the time. But I will just talk about the directions of studies. One of the largest studies that I'm very proud of is a longitudinal study of looking at impact of exposure to war trauma among Syrian and Iraqi refugees in Southeast Michigan. And this all started when I came to Wayne State about 8 years ago, and it was in the midst of the Syrian war. And I looked at the literature to see what is the impact of exposure to war trauma in these people, and there was not much. There was almost none from Western world, very few studies in children. So we put together a team of volunteers, basically refugee doctors themselves from Iraq and other countries. And we went to basically primary care clinics at the American Chaldean Council when these refugees were doing their initial health screening. Basically, long story short, we recruited 400 adults and children. We were the first to establish the impact of exposure to trauma, not only looking at PTSD, but also other important consequences of trauma exposure, including anxiety, separation anxiety in children, depression, and then established a larger study, which, as my dear colleague and a pleasure to work with, Dalia mentioned, we have got funding from the NICHD, a large R01, to basically continue this work and look at the longitudinal changes of symptoms in children. Because in research, usually people say, oh, we found this person at this point in time, they had exposure to war, and now they do or do not have PTSD. And PTSD is not a plus minus illness. It's just a range of symptoms that can oscillate and go up and down. Everybody in the clinic knows that. So basically, the idea is to look at how the symptoms oscillate throughout the time, because some also may argue, oh, they are now outside of the war zone, so they shouldn't have any problems, which is wrong. And we also look at the environmental and biological correlates of these changes. Biologically, we have been looking at genetics, epigenetics, inflammation, which was mentioned in the previous conversations as an important link between the mental health and physical health, as well as autonomic responses, parenting, all the different aspects of environment, from psychosocial to perception of support from the government and environment, and housing. And this work has been important also in a sense that we brought biological research to this field, which was mostly epidemiological before this, and more importantly, brought this field to the biological psychiatry. For example, there's this large collaboration across the globe on basically looking at genetics of PTSD, anxiety, depression, and basically people of Middle Eastern genetic background were missing from this. So we basically were the first who joined this collaboration to basically be these samples be more representative. We also started the art, dance, and movement therapies for refugee youth and their mothers with mindful yoga, because with the idea that a lot of traditional methods of addressing trauma, including medications or more traditional psychotherapies, may not be feasible, would be more expensive and less viable in this population. We started again with all volunteer work, and it basically was very successful. We managed to basically expand this across the state. Helen is here, we have been working with the state and with Global Michigan to basically expand this interventions, which are cheaper and effective and not very costly and can be done in group settings across the state. We have been consulting with the states to work with schools across the state, basically training and educating, helping the school staff understand what's in the mind and life of a refugee child and what are the specific challenges and how we can have programs that can serve refugees, whether they're from Middle East or Middle East or Afghanistan or now Ukraine. Handle these. Have been also involved recently, unfortunately, with Ukraine, what's happening there, and helping people basically who are building and capacity building to address trauma in people who have, for example, there is a center they're building for people who have lost a limb. So we are consultant to them. We are working with several groups to do research studies and also training how to address trauma. I'm very proud of an invention coming out of our lab utilizing advanced and novel high technologies of augmented reality for treatment of these situations. We have started using it with first responders in a project we have with first responders across the state. It starts from the training to peer support to education to prevention and also treatment, all disciplines of first response across the state. Finally, what I've been proud of is being able to talk with the public about these important issues, specifically this work that we are doing with the Syrian and Iraqi refugees and refugees in general. We have been able to go on the CNN, NPR, Scientific American, Lancet, and tens of other media to basically let the people know what's happening here and fight against some of the misinformation and demonization of refugees, and specifically those of Muslim and Middle Eastern background in this country. I think my time is up. If anyone would want have any questions or I could be of any help, please feel free to reach out. You can see actually the website right behind me, so you can find me there.
Thank you so much. And thank you for sharing your innovation and creativity in helping the community.